excellent. Good morning. This is an excellent week here on the 9:30 call. We have incredible guests lined up. We do record the 9:30 calls, so these will all be available on our YouTube channel. And as we are so excited today, you saw the topic for today. If you have questions already, you can add them to the chat or you can send them to me. Just we know that Mary Beth and Margaret will have a presentation and then we'll have time for questions. But it's always helpful to send the questions. And if you don't want to send them to everybody, you can just send them to me and then I can ask them. I will monitor the chat and ask questions. So, Mary Beth and Margaret, you don't need to worry about that. So, good morning, and we are so excited to have with us this morning Mary Beth Miotto and Margaret Albright. And I've shared with them that our first question is for each of them to tell us a little bit about themselves, and they were really excited this morning for your update. So, I'll turn it over to you.
Great, you can go ahead first.
Thanks, Mary Beth. I'm Margaret Albright. I've been involved with Mass Families for Vaccines for the past 4 years. We're an advocacy organization trying to change some state laws around childhood immunization for school attendance. I got into this when I was on the school committee during COVID and realized how serious it can be when there's an infectious disease outbreak in terms of disrupting our children's lives and causing severe illness. So that's how I have gotten involved with this, and that's how I met Mary Beth.
Thank you. And I am Mary Beth Miotto. I'm a pediatrician, a mom, a neighbor, and I have been a pediatrician for a long time. And as you all know, if you have children or obviously take care of children, is little ones come to us a lot. And they can be sick a lot because they touch everything, which is great because I love developmental pediatrics too. So they touch everything and everybody, and we all live together in a sea of germs. So I've been trying to talk more openly about people's questions about vaccines and from all those different perspectives for quite a while now, but especially actually a few years before COVID. I feel like we started doing a good job of asking questions, and I love that. And so that's my main goal generally, but I do a lot of work specifically with young children. I am a pediatrician in Mattapan in a community health center, and I also have like what we call a micro practice in Northborough where I live, because I also care for kids with autism and ADHD and learning and school problems, which, as you all know, start giving heartaches to families sometimes early, but there are a lot of solutions if we have a big team, and this is my favorite big team that I'm sitting with.
Thanks so much. And as you can see, and Margaret, we also know you did a lot of work in Newton, around full day kindergarten.
Yep.
So you've been involved. We've known each other for a long time. So we're excited. We know you have slides. And so as we say, this is the hardest part of the 9:30 call, but time to put the slides up. And thank you, Neri, for adding all the information in chat. And right on cue, the leaf blowers are outside my house. So I'm going to go on mute.
And I'm already having problems. Already having problems. I may stop sharing because I did it before and I'm going to try again.
We could see them. You might not have been on the first slide. And we know tomorrow on the 9:30 call, we're going to hear from Jessica Acevedo. We'll have sharing the mic on Wednesday. And then Liz Sweet from Mira will be with us on Thursday. And there also, if you have questions that you want to share ahead of time for Liz Sweet, I added my email address in the 9:30 call email. So you can just send me a quick email. We'll send them to Liz.
Yeah, I'm having problems. So I'm sorry. I'm going to ask, Margaret, do you want to go ahead and put yours up? Sorry about that. It was going before, but now I lost control. Thank you so much. And we can just go on to that first slide. Or the second slide, yeah. And so again, as I sort of said, I'm so pleased to be with you all. I'm going to be covering the vaccines just to get us all on the same page in a very crazy time. This is a time where I would actually, if I weren't a geeky pediatrician, I'd tell you to stop reading all the articles because they're really confusing. There's a lot of chaos right now. And what I'm trying to be here to say is let's cut through the chaos and just get to the facts. The politics can give us all a headache. We need to be politically aware, but we're really here just about children. And that can be sort of our guiding sort of North Star. And I can tell you a little bit about what's changed and really what's not changed that much and what is all that chatter and when you have to listen to it and when you can tune it out and resist the chaos. So this is some of those, reading the papers, reading social media that it just in what we're September 22nd. Chaos started before that, but especially around vaccines, a lot of things started happening in June, firing people July, changing things August, firing some more people, getting rid of some people, and then this past week. So that's sort of the background, but I want to just translate it a little bit. The immunization schedules, it can feel very tumultuous and rough, but honestly, we have been here before. It's a long history, and really the compass is about how does it affect our children, the children in our community, and how do we keep that firm hand on the helm for all of the families and workers and staff who are appropriately like, what do I need to know? So next slide. So just to give you an idea, this is the reason I can be fairly calm amidst this chaos is that vaccines are not new. Okay. I actually went through the list just to show you because people are like, oh, there's so many. They're really old. In fact, smallpox, which there's a huge history of smallpox vaccine that is actually focused on Massachusetts because Massachusetts was a big progressive idea of figuring out individual liberty, group liberty, science, and so forth back in the 1700s, John Adams, Cotton Mather. But what's really interesting is that was in the Western Hemisphere and in Africa and Asia, there's good evidence that the smallpox vaccine or similar to vaccine actually started well before that in other continents. So again, things have been going on for a while. Nothing's that new. And I will tell you enough about my age to say that I finished my medical school in 1992 and finished training 30 years ago in pediatrics. And for about half of those vaccines that you see on that screen, I saw the kids before they got them. So I actually have been a witness to history. I took care of kids who had H. influenza B, who died from H. influenza B, pertussis, same, hepatitis B, pneumococcus. I've seen the before and after. That actually makes me calm just to let you know what that is. So we were the American Academy of Pediatrics, and I am involved because I like education and advocacy. It was established in 1930. Believe me, it's going to be tumultuous between government and organizations, but we can see it through. Next slide. And just again, really quickly, ACIP, you'll hear this term ACIP. The Advisory Committee on Immunization Practices is now part of the CDC. Originally, these schedules that we all know when we go to the pediatrician's office and elsewhere, school, preschool, the AAP sort of was in charge of figuring this all out through 1964. Then the government, the CDC eventually got involved, but then was more giving guidance a little bit on the science. Only in 1995, so actually the year I went into practice, was there a CDC schedule. And what that was is it just said the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians, let's just make sure everything's on the same page. We're going to do it together. And so that's what's been going on since 1995. In 2010, and I do like that this is to highlight this, we got to always get better about talking about science and making it really logical. So in 2010, that group that met last week began using a bunch of rubrics that made more sense. So like a grading of recommendations system that said, okay, if we have 1,000 studies, how do we grade all of them and give them weight to make sure that they're all scientifically as valid and so forth? And then they also have another rubric to say, well, how does the science compare to what parents feel and what society costs and things like that? So in 2010, that whole system of discussing things got better. Next slide. And could you just click through so we could see I had animations on Margaret, and one more click. So the only problem that I would see is process right now, but it's a big problem. Okay. So if y'all didn't tune in last week, I did, to some of the hearings. And the problem is that there's not a lot of experience within the new ACIP panel. There was a lot of confusion. The wording probably isn't going to make it through the way it is because they just haven't done this work. That's what happened when they eliminated all those people. And both the science and the process got very mucky. And the organizers and leaders outside of that group threw out those game books, what I'd say, that grade and the evidence to recommendation rubric that sort of keep the discussion, the analysis, and the votes relevant, science-based, and on target. That's also important because there have always been members on the original group that were parents and nurses and community people. So there was always a variety of perspectives coming in, and those playbooks actually helped everybody give their perspective, honor the science, but stay really logical. That's, I think, the biggest but right now that we're dealing with is that a lot of stuff, don't worry about it. I want the process to be better because at some of these meetings, these participants were actually saying, we have no idea what we're doing. That we don't like. We want our kids and the kids we take care of and the staff who are taking care of them, because their health is really important too, to feel confident. So next slide. So, and these unfortunately aren't animated to Margaret. So where we are now with what happened with the CDC so far. In July, flu vaccine, you might have heard about some of the stuff with that. There are multi-dose vials that are rarely used, but that contain a substance that keep them free from bacteria when a needle keeps going in them. When I go to the pediatrician as a mom, or I go to the doctor, they'll take one bottle out and they'll put the needle in and then throw out the bottle, right, in the needle. If you have like a big clinic, think about like in other countries or huge clinics, it's easier to transport and store things in multi-dose vials, but then you have to keep putting a needle in it, and that could bring bacteria. So there was a substance in there, which was later proven, it was taken away from a lot of vaccines, but was later proven that it didn't cause problems. But the CDC, this meeting, wanted to get rid of the only vaccine that had thimerosal. So that's gone now. That doesn't really impact individual families. Honestly, I don't know one pediatrician who's ever used it. That multi-dose vial, generally we use one at a time. So really not much impact on individual families or communities. Then in September, so on Thursday, they talked about the MMR varicella combination vaccine, and that had some flexibility based on the science, but the first dose of the vaccine, who can get it and what age? And there was, as I said, some flexibility to that based on discussions between the parent and the pediatrician or nurse practitioner. And that change, the only change that happened is a decrease of flexibility. Again, most of us were not using that product for the youngsters, the youngest ones. So not a huge impact for what we're going to see on access or anything like that. And one more click. COVID vaccine, again, not a lot of change. We still want people to talk to their medical team, but as the votes are now, you can still, for big people, you can still go to the pharmacy without a prescription, just based on what the CDC federally says as of last week. And younger children should be fine. And again, this is for at risk or high risk and not at risk, if you want to define them that way, people, no matter how you define that. Pretty much everybody's going to be able to get them. So I hope that already is going to reassure you. Something was deferred at that meeting last week, which is the hepatitis B vaccine birth dose. They were presented with a lot of evidence of the safety, and the CDC specialist came and talked and whatever. And then Friday morning, they decided that they just didn't feel comfortable enough to have a vote. This is, again, a very old vaccine. And the birth dose started when I was a resident young physician. So I saw the difference in numbers and all the different things. But right now, no changes. So could there be changes? Yes. But as of September 22nd, you're not going to see a whole lot of difference. So next slide. Now, there is a lot of difference in the process, and there's a lot of difference in how the CDC is talking and how health and human service leaders are talking, and that's created a lot of chaos. And so there's so much talking about getting rid of everything that the medical societies that originally, as I showed you, were the ones who came up with the vaccine schedules, they have gone on because of a lot of that talking to say, we are going to keep the schedules from probably September of last fall, and we're going to establish the evidence-based immunization schedules the way they are, keep doing the research, not stopping, but we're not going to necessarily, unless it's evidence-based, we're not going to be rolling back things without evidence. So that's you probably hearing a lot about. And that's a lot of major health professional societies, my Academy of Pediatrics, the obstetricians, the family doctors, the internists, the infectious disease people, the nurse midwives, the pediatric nurse practitioners. And so pretty much all of them are supporting this harmonized immunization schedule for children and adults. And so you will hear that a little bit. Right now, you can go to the next slide. There's not much of a difference if you now look. For the flu vaccine, like I said, the industry had already moved away. You could theoretically use that from the AAP schedule, although the reality is it's just probably just going to go away because what drug company is going to want to make that? But again, does that affect your people? No. That varicella combination vaccine, that's an area that's slightly different because of that shared partnership between the prescriber of the vaccine and the families. The AAP still stands by families making the decision. And just to be really clear about when that would happen, I've used the combination vaccine before age 4, and I think I used it at like 3 and 11 months when I had, and this is a pretty uncommon but compelling situation, I had a child show up at that age who had not come to the doctor since they were 6 months old. Mom really wanted to get their child vaccinated, but she was deadly scared of needles. And I figured that out sort of backwards because I'm like, okay, let's figure this out. How can we do this? What do you feel? And she said, after talking and calming and breathing together, can I step out of the room when you give the vaccines? So then we had a different conversation because obviously she was really scared. And she said, no, it's just a needle. I just can't deal with needles. So I could never come to the doctor with my baby. And I don't have anybody else. So that was a time where I was like, listen, this child has a lot to make up. And let's talk to the mom. slightly increased risk of a fever seizure. I mean, at that age, honestly, at the 11 months, it wasn't a big deal. But, that's where people come up. It's a very low risk, and fever seizures don't hurt in the long run. But listen, if you're a parent who's seen a febrile seizure in anybody, you might be nervous. So again, it was a shared decision-making thing where we need to be really careful. So that's one difference between the schedule from the AAP, if you went on their website, or American Academy of Family Physicians, or any of these others, NAP, and the CDC. The COVID vaccine, you're not going to really see any difference, except the AAP will say recommend, and the CDC pretty much says allow. And so it comes at a different sort of opt out or opt in. And even, to be honest, I don't even like calling it opt out, because I've never seen a kid get a vaccine that a parent didn't want. So it's not really opt out. It's sort of like, do I lean a little bit into more recommending, or saying, hey, what do you want? And it's language for COVID. So next slide. And then add, just to make things more chaotic, good chaotic, but chaotic for us, the governor and the Massachusetts Department of Public Health were again hearing all this very rhetorical speech from the federal government, like, we're going to get rid of the vaccines. Vaccines are bad for everybody. So Governor Healy and the Commissioner of Public Health worked to develop policy that allows them, if at some point the federal government says no vaccines, and it's not based on science, in their view, in the state's view, that the governor and the Massachusetts Department of Health can have an immunization schedule based on the professional societies. They also went to the health insurance plans around the country as well as in the state, and Massachusetts health insurers will continue to cover COVID vaccine, for instance. And it appears that they're just going to be all working together. And if you look, there's this map of the states, and every state between Maine and New Jersey, Pennsylvania, except for New Hampshire, is now in this Northeastern Public Health Collaborative. Maryland just joined, so I don't know, it might have to be Eastern, just like the West Coast has a public health collaborative. So they're bringing a lot of science together. And again, right now, not anything to look at. It's not a train wreck, because there hasn't been as much change as talking, a lot of rhetoric. So next slide.
I have to stop.
Oh, so that's funny.
There we go.
Okay. So I'm not here to tell you what to think or what to do. I'm telling you sort of what to know, how to get that static and that chatter, and just sort of be like, okay, where are we? Right now, we are not on that windy road as much. There's a lot of talking around you that makes you sort of feel like you're going around, but pretty much going straight ahead. Keep calm, carry on, stay the course, not a whole lot. And it's really about maybe the best thing, I really like to find the best way forward, talk more to the people who have the information, and talk in your groups, in your early childhood groups and whatever. How does this affect us? Does it affect us? Talk to your pediatrician or other healthcare providers. Just the talking in a positive way. I mean, I just don't think there's a lot of panic. There's a lot to dissect, but not a lot of panic. Next slide, I think, is maybe my last. The science hasn't changed. No new science has been introduced. This is, unfortunately, a lot of politics. We've been through some chaos, and I think the pandemic was a really good example for everybody, but especially in the early childhood education and social services community. There was a lot of going on, and we felt that we had to really watch for those little kids and their ability to get educated and such. We can keep doing that. There's not that much of a change, and you just keep supporting the families. I personally am most concerned about the families and their feeling like, A, nobody's out helping them, and B, like, what's going on? Is this a full-time job I got to keep track of to make sure my kid's safe, which is a little bit like COVID was? And we just need to communicate better. So I think I'm going to pass the baton over to Margaret, who I also am involved in the group families, the group for vaccines. I feel like, again, we need groups that represent families, teachers, nurses, doctors, school committees, everybody together. And that's why they do such a good job. So thanks.
So I am speaking on behalf of Mass Families for Vaccines and the work that we are trying to do here in Massachusetts, and kind of drawing a line to why you as early education providers should be concerned. So Massachusetts laws on childhood vaccine for school attendance fall short. Right now, a growing number of families are using religious exemptions to opt out of school immunization requirements for non-religious reasons, leaving schools vulnerable to dangerous disease outbreak. And we saw this year a measles outbreak in Texas and New Mexico, where thousands of cases of measles surged across the country. Measles is highly contagious. It stays in the air for hours after a person who is infected has been in the room. So you can be exposed and not have ever met the person who had the measles. And the person who had the measles might not have even known that they were contagious at that point. An additional worry is that Florida is proposing to do away with all vaccine requirements for children altogether. And I know from my experience, I have a adult son who works in the infectious disease area, tracking infectious diseases worldwide, that he says there's a lot of measles worldwide. It circulates everywhere. And it's not just measles, but there's also whooping cough and diphtheria circulating worldwide. So the effects of these chronic diseases, people have forgotten how serious these can be. But, you know, they can lead to pneumonia, encephalitis, heart failure, seizures, developmental disabilities, stroke, hearing and vision loss, hospitalization, and death. In fact, a child in California died last week from the after effects of having had measles before the age of 2. It's a very serious and uncommon complication, but it does happen. So the reason you should be concerned is that children too young to be fully vaccinated can be at risk for serious illness. In particular, I've talked to Dr. Miotto about this, but whooping cough is particularly serious for young children, and they cannot be vaccinated before a certain age. And daily operations can be affected. The quarantine period for measles is 21 days for anyone who has been exposed, whether they get it or not. They are excluded from any public place and from school, and it could possibly cause a center to have to close if there has been a measles exposure. So right now, current Massachusetts law falls short. So in order to exempt your child from these vaccinations, you must have either a letter for it from a physician, or a parent or guardian must state in writing that the immunization conflicts with their sincerely held religious beliefs. That's a pretty big loophole. Mary Beth and I have both been to these hearings on legislation, and the sincerely held beliefs are across the board in very wide spaces, let's say. So the law that has been introduced is H225 or Senate 1557. It was introduced by Representative Vargas from Haverhill, who is a father of young children. And he brought this forward because one of his constituents who had a child who was immunocompromised brought this issue to his attention. So the bill would eliminate the religious exemption for vaccines entering school. A medical exemption would remain in place, and schools would be required to annually report to DPH the total number of students who have been immunized and those who have a medical exemption, and DPH would have to publish this information.
Margaret, I'm so sorry to do this, but it's 10 o'clock, and
Okay.
that's the end of our call. But I'm wondering if you can come back on Wednesday at 9:30? Are you available?
No, I'm sorry. I got a meeting.
Okay.
You can see this information here.
Yep,
Connecticut,
I
New York,
already
and
posted the
Maine.
slides.
Yep. Connecticut, New York, and Maine already do this, so it would be
Okay.
joining the team.
And then Mary Beth, there's a Kelly Pellegrini put a lot of
Right,
questions in chat. So
right.
I'm wondering
So
if you, yeah.
yeah, so I can come on Wednesday,
Okay,
but
so
I
why
can
don't you,
also put it in writing
that would
because
be
not
great.
everybody else can come in there. So Margaret and
Okay,
I can work on the writing part of the answers, because I also want her input into these. But I
excellent.
can come back and people can think about questions and just be here in case you guys have it.
And then Margaret, what's one thing that you hope that we know?
The 90% of voters and 70% of families, 75% of families with school-age children support getting rid of the
Right,
religious exemption. So you may hear a lot of people say, oh, this is impinging on my personal freedom.
right.
Most people in Massachusetts do not believe that way.
Great.
Yeah.
Thank you so much to both of you. We know this, it's a lot of information to pack into. And Margaret, we would love to have you back. When is the bill going to be up for a hearing?
So the bill has passed through one committee, it's on to the
Okay.
next committee. So it's going to be in the legislature probably for the rest of this session,
Okay,
maybe into
great.
January. So
We would love to have you come back to tell us more. Thank you both for joining us. And for 9:30 callers, we will save the chat. The slides are posted. The recording will be available. And Mary Beth will be back on Wednesday. So we'll send an updated kind of update to the field so everybody knows to come back on Thursday for that. Thank you so much for joining and for all the information. We know this is something that folks on the call are seeing every day and want to have good information to share with families. Thank you so much for joining us. Have a good day.